My name is Dorothy. I'm 98 years old. I live alone in this small house in Wisconsin, in a quiet neighborhood. My old nurse's uniform hangs on the wall. I've kept it since 1953. I don't wear it anymore, but I can't throw it away either. I was a nurse for 52 years. Intensive care, emergency room, elderly care units. I witnessed thousands of people's final moments. I held their hands. I delivered bad news to their families. I stood beside doctors signing death certificates. And I'm going to tell you this, most of them didn't have to die when they did. Doctors diagnose. They prescribe medication. They operate. But we're the ones at the bedside. We're the ones waiting beside them for hours. Who recovers? Who doesn't? You learn to see it from how their chest rises, how their eyes look. After 52 years, you learn to see it. And you learn something else. People kill themselves, slowly, without even knowing it. I started working at the hospital in 1965. I was 20 years old. First month, a man came in, 58 years old, heart attack. We saved him. He recovered. When he was discharged, I said, "Mr. Johnson, quit smoking, go for walks, or you'll be back in 2 years. He smiled. "Okay, nurse," he said. He came back 18 months later, bigger heart attack. We couldn't save him. This story repeated thousands of times. Different names, same ending. The first thing I noticed, lonely people die faster. Same disease, same treatment, same age. But there's a difference. Some have visitors every day. Spouse, children, friends come. They hold their hand. They talk. They make them laugh. Some have no visitors. No one comes for weeks. Just nurses. Just us. Patients with visitors recovered faster. This isn't statistics. It's reality. Complication rates after surgery were lower. Infections were less common. Recovery was twice as fast. Why? The body knows. In 1978, there was a woman, Mrs. Williams, 72 years old, cancer surgery, very difficult surgery. Doctors said 30% chance. Her 8 grandchildren came every day, in shifts, morning to evening. They read books to her, held her hand, sang songs. 6 months later, she was discharged, lived 15 more years. That same year, another woman, Mrs. Martinez, 68 years old, same cancer, milder case. Doctors said 70% chance. She had no visitors. She had children, but they didn't come. They were busy. 3 months later, she died. Not from the disease, from loneliness. Second thing, people don't take their medication. When I first learned this, I was shocked. Doctor writes prescription. Patient goes to pharmacy, gets the medicine, but doesn't take it. Too many pills, they say. I'm fine anyway, they say. Side effects are bad, they say. Then they come back. Stroke, heart attack, kidneys failed. Did you take your medication regularly? I ask. In 1985, we set up a system. Prescription tracking. We got data from pharmacies. Were patients picking up their medications or not? 40% of patients weren't taking medications regularly. 40%. These people come to the hospital for treatment. They have surgery. They suffer. Then they go home and don't take the medication. Why? Because no one checks. Because they're alone. Because they forget. Because they don't care. Third thing, people come too late. Chest pain started 3 days ago. It'll pass, they said. It didn't. Got worse. I'll wait a bit more, they said. then couldn't take it. Called ambulance, came in too late. For stroke, there's a 3-hour window. If you get treatment in the first 3 hours, damage is minimal. After 6 hours, temporary damage. After 12 hours, permanent damage. Most came after 12 hours because they waited. There was a man, Mr. Thompson, 65 years old. His speech got slurred at 7 a.m. His wife noticed. Rest a bit, she said. Let's wait until noon. They waited until noon. Got worse. Came to hospital at 3 p.m. 8 hours had passed. His left side was paralyzed. Never spoke again. Lived in wheelchair for 8 years. Then died. If he'd come at 8 a.m., he would have recovered completely. Fourth thing, people don't move. Retired patients were the riskiest group. Why? Because they stop. When working, they walked, climbed stairs, moved. They retired, sat on couch, television. Within 6 months, their health declined. Knees hurt, back hurt, circulation slowed. Within a year, serious problems started. Blood pressure, diabetes, heart. I'm tired, they said. Of course you're tired. You're not moving. Muscles are wasting. Energy's gone. There was a woman, Mrs. Davis, retired at 70, active woman, teacher, walked to school. She retired, sat at home. I earned this, she said. Now I'll rest. 2 years later, knee replacement. 4 years later, heart problems. 6 years later, diabetes. 8 years later, died, age 78. But could have lived 10 more years if she'd moved. Fifth thing, they don't take sleep problems seriously. I'm old, I sleep less, they say. No, elderly people need 7 to 8 hours of sleep too. They wake up 4 to 5 times a night, go to bathroom, then can't fall back asleep. I'm in bed 8 hours, they say, but not sleeping. No deep sleep, no REM. Results are terrible. Memory problems, balance issues, falls, fractures. In patients who slept poorly, dementia started 10 years earlier. Sixth thing, living without purpose. This was the most painful. People retire, then don't know what to do. They wake up in the morning. What will I do today, they ask. No answer. Television, eat, sleep, repeat. 6 months later, depression. 1 year later, physical problems. 2 years later, serious illness. The body asks, why are we living? Can't find answer. There was a man, Mr. Wilson, retired at 68, engineer, very successful. What will I do now, he said. I worked my whole life. Now what? I said, volunteer, teach, garden, do something. I'm tired, he said. I want to rest. He rested for 2 years, then died, age 70. But there was another man, Mr. Peterson, retired at 70. Next day went to library, volunteered, started reading books to children, went every week until age 92, died at 92, sharp mind until the last day. I'm 98 years old. I was a nurse for 52 years. My husband died 12 years ago. I have 3 children, 7 grandchildren, 4 great-grandchildren. I walk every day, go to church every week, visit my neighbors, read books, call my grandchildren. I have purposes. I have reasons to live. I'm not special. My genetics aren't good. My mother died at 68, my father at 71. I made choices every day for 50 years. I'm telling you, most people don't have to die. They choose to. They choose to live alone. They choose to stay still. They choose not to take medication. They choose to come late. They choose to live without purpose. You're making choices right now, too. What will you do tomorrow morning? Sit on the couch or go for a walk? Will you call someone or stay alone? Will you take your medication or say, I'll skip one day? These questions may seem silly, but they're not. These are life and death questions. I saw it for 52 years, thousands of times, same choices, same results. You can be different, but you need to make choices now.